So we have another project. The owner loved what we were doing once again, and they gave us another contract. Negotiated, but they gave us an IPD, same design team, same partners, same owner representative even. It's about 50 miles north of where we were. So Anthony actually had to drive. He had to get in his car. Rough life, huh?
More than doubled my commute.
It was a 51-bed expansion to a mental health hospital. Same owner, but they are investing heavily in mental health now in California, especially. And so this is pretty exciting project. Not as complicated. Probably the value would be, close to 50 million if it was a regular hospital. Mental health don't have as much technology, don't have as much of the operating rooms and that nature.
Before we move along there, could you touch on the exterior system that project used?
Yeah, so going back, so this is an EFIS system. It's actually prefabricated. So Anthony forgot to mention, but on the first Temecula job, all the interior walls were prefabricated, and they were brought to site, and the electrician and the plumber actually installed the electrical in-wall and the plumbing in-wall before the wall got placed into the hospital. A lot of the savings was because of that, I believe.
Yeah, I actually want to provide a little more insight even. This was before prefab was like the thing to do in the lean world. It was a concept, but especially with our jurisdiction, which requires basically eyes on everything, we didn't understand how to accomplish it. So our first attempt was we created this giant tent on the side of our project, right?
Yep.
And there were
avoiding the owls.
Yes, yeah, avoiding the owls. And we prefabricated a lot of the components on site. It worked because since we were on site, the inspectors didn't have to go afar. And then as they gained our trust, then we were able to remove our prefab operations off-site. And then we worked it out that they would come inspect at certain intervals, right? Now, on this project, by the way, that was just DPR, self-perform, drywall and framing, kind of taking it upon themselves to do that. That concept and that idea actually turned into a whole new entity within DPR itself, correct?
Correct. So now we have a facility in Phoenix, Arizona, different state lines, so you're paying a little less for the labor. And they're making a lot of our walls, close to 50, 60% of our walls now on today's projects, and shipping them to California to then just be set and installed. So on this project, these panels were the first in California for a hospital to be prefabricated with an EFIS system. So that means we were literally able to set the entire exterior of this 50,000 square foot expansion in 3 days. Pretty cool. Normally that would take a month, 2 months.
And that decision actually invited a new stakeholder to our IPD in the jurisdiction. So the jurisdiction is often quite stringent, but because we've had 4 projects back to back with this group, they understood who we are, they understood our intents, and so they heard us when we said, we believe we had a better way that not only works for the owner, it makes your job easier as well. So we collaborated with the district engineers, the structural engineers, yep, to review what it is that we're going to be building off-site and the process of getting it to site, which, let's think about it. If we prefab a wall and that has screws in it and you truck it from Arizona to Southern California, 7 hours roughly, the vibrations might be concerning for the screws loosening up. But we assured them that with the belt and suspenders approach with tacking as well, that what we receive on site is just as good, if not overbuilt, from what we might need otherwise or build in place. So that was a huge and underspoken, under-celebrated win for us to get the state on our side. And I assure you, and I'm not being pompous when I say they wouldn't have done it for any team. And I know this because we literally have letters that says we wouldn't have done this for just any team. And it's something that we frame in. We have it in our office. It's true.
So monitor, measure, manage. We were always monitoring milestones, right? We were always had a date for a milestone. placing the concrete footings, and we were able to see where we were on that schedule to actualities. Phases, exterior complete, that date we were able to monitor that. Weekly work plans, PPCs, right? Are you guys familiar with weekly work plans? It's from the last planner system. You're translating the pool planning into a weekly work plan and then giving yourself either green checks or X's, and that will say, oh, you made 80% of your commitments that week, or you made 60% of that commitments that week, and then you have to look at improving why you're meeting that. And KPIs, so key performance indicators. So PPC, as we talked about, production was the new one that we added onto the last phase. We weren't tracking that before, but we started adding that. So we're always going to keep these going, and burn rate, the budget.
So before we move, just look at all the dashboards and the data that we have at our disposal. If you think about it as healthcare builders, it reminded me of a place that I hope not too many of you had to go, which is a patient room, right? So imagine that you are in the hospital. You've got all kinds of things hooked up to you, right? They're beeping and ringing and doing that thing, right? And there's numbers galore. And to somebody, that means something, right? Well, for us, it's builders. When we look at those KPIs, we understand what they mean. But as John had mentioned, they didn't measure what we're now most interested in, which is team morale, right? So then I go back to the hospital room where we're sitting in our bed and we're hearing all the beeps and seeing all the numbers. And something they don't have a number for or a machine for is when they come in, they ask you a question, right? They say to you, how are you feeling? And you point to this. Despite all the technology behind your stay in the patient room, this is probably the most telling, right? Those numbers don't tell you how you feel. And so we took this concept and we thought, okay, well, how can we make this work in our world? And we look back at the Manifesto for Agile Development, which is very closely related to lean practices. And there's a statement in the manifesto that reads, individual and interactions over process and tools. So in this case, don't worry about what the numbers say because they can't quantitatively define how I'm feeling today. I can't tell you if I'm an 8 or a 10, right? At least not without making sense. So in many ways, we try to use this chart and again, put some science behind it. So John was critical in developing what that science looked like, and it was based on the conversations of onboarding, right, and what's important to the team. And John will tell you a little bit more of what we decided what was important for us.
So remember those conditions of satisfaction from COSs from the previous job. We took those and modified them. We really honed in on being able to measure them instead of just looking at the board and seeing them and saying, yeah, that sounds about right. We want to quantify those conditions of satisfaction. So here's what we came up with. Here are our conditions of satisfaction again. Let's just look at one for example. All team members agree the project was positive and would prefer to work with the project team again. So we're going to send out a survey. So of course on the last project everyone agreed, yeah, that sounds about right. But how do we quantify that? So we developed a survey system and we wanted to have 80% satisfaction in order to meet that COS at the end of the job. So we wanted to quantify that condition of satisfaction. Owner and user satisfied with the product and would prefer to work with the team. So we would send a survey to the owner and actually ask, would you want to work with this team again? And we were hoping for an 80% satisfaction. So here's our scale. So when we sent out this survey, we were going to have our conditions of satisfaction listed. And we were going to say, okay, 1 to 5. We were hoping for 4. That's the 80% that we were looking for. And here's how we, 1, very rare, means never, and then all the way to 5, where we have a strong level of trust, and we strongly identify with our team, not just our individual goals. So here's our team health check survey. This is the first one that we had at DPR. We've now been using it on a couple different projects, not only IFOA projects, but we listed our conditions of satisfaction and our KPIs. We sat in a room, in the big room, put all the KPIs that we thought were important, marked them with stickers, put them on the board, and then gave them line items. So for example, commitment, the team makes reliable commitments to each other to support the project schedule. So we were actually going to ask weekly in our big room meetings, which big room, I don't know if we've talked about yet, but the big room means that once a week or twice or once every 2 weeks, everyone meets, right? You have the trade partners, you have everyone who's in that IPD agreement, the owner, the architect, the designers. We're all going to huddle for about 4 hours. And one of the cool things that we did in that 4 hours was have 45 minutes dedicated to reviewing our team health check, which turned out to be pretty successful. So what do we do with that data? So as you can see here, you'd fill this out. Every member of the team, it would be different every 2 weeks, and give us a score. We take that data and we see what we can do to improve. We obviously look for trends. We see what changed in the week. So you see on that feedback, we have that plus delta. So you see if there's any trends that we're looking for. What can we be doing differently? And we really spent that 45 minutes to an hour, sometimes more, to discuss. So here's how the data looked. This is an example of number 5, the collaboration. We can see here that there's a pretty good trend in the 4s. That's what we wanted on our conditions of satisfaction, to meet our conditions of satisfaction. But there's a little bit of a dip in February. So during that month of February, we decided to meet as a team and talk about why that dip happened. So it turned out that due to production tracking, the electrician was reporting incorrect numbers, and the project engineer at the time actually was the one that reported it and said, well, they're showing 50% complete, but they're actually only 20% complete, so their numbers are a little off. So we did a deep dive as a team, and we learned, yeah, they're not accurately doing production tracking. So we addressed that as a team. We asked for more additional help on the electrician side. We offered to have our engineer help them on their side. And as you can see, the next week they were back on track. They were reporting their numbers accurately, and we could gain that trust back that we lost during that month of February. Another example, visual management. At the beginning of the project, we had a goal. We had a goal in our conditions of satisfaction to use visual management for every aspect of the job. April, that's design, right? You're in the middle of the design, and then you're going into excavation. You're not really collaborating. So the visual management score was getting kind of low. So we were like, what can we do to improve that? Well, we started a pretty good trend upwards because we got more team members involved. We were getting the trade partners involved. We get to in-wall, and you can see our numbers are close to 5 when we're doing in-wall, because we were collaborating as a team and making these visual plans to show sequencing. So we were able to use takt-time planning and give everybody their own space. So our visual management literally went up as we went throughout the job. This is an interesting one. So as I said before, this was a behavioral health hospital. Now this team has done 5 projects. None of them were behavioral health hospitals. They were all typical hospitals, operating rooms, patient rooms. But we had some learning to do. In the month of June was the make-ready phase of the project. So we were in the actual hospital doing some demo work and building tunnels to be able to expand the hospital to 50,000 square feet. And the owner had a issue with, I believe it was a mechanical contractor who kept leaving his tools in areas that were accessible to patients. And you might say to yourself, well, why does the owner care that he's leaving his tools there? Well, it's a behavioral health hospital, so it's actually a danger to those patients. So that was a big lesson learned on this project. As you can see on the safety, on the safety and the end user satisfaction, huge red flag. So we addressed that in that big room meeting. We addressed it in our conditions of satisfaction, and you can see how drastically we improved. It never happened again, of course, and it's because of this survey. We believe it's because of this survey. So After those couple examples, a couple key takeaways. I want to emphasize how important it is to scale. We had that one bad project where we had too many cooks in the kitchen, and it just became a mess. So you want to have those cluster groups and pick the right people to be in the room. Facilitation is key. Having those 45-minute sections every week or every other week about reviewing the team health check survey, super important, super valuable, because you're really diving into the nitty-gritty and not necessarily the surface. And you're solving issues, and you're seeing what the team can do better to work better together. Making the time, of course, that hour in those big rooms, and then filling out the survey. And then on the bottom of the survey, we also had areas to improve, so we reviewed those. Be timely. We were live doing it, so we would fill out the survey in the morning before the meeting even started. We would have our FOC, kind of the secretary, enter the data into a graph, and then we would look at those graphs that we showed you and really, try to see trends that we could try to improve on. And then we had a goal every week to at least try to improve one thing. So I would, if you tried this health check survey, you really want to have one area of improvement, and you can always, it's continuous improvement, as you can see from our slideshow, right? We just got better and better as our projects, and we got more involved, and we're developing better friend relationships, and we were able to challenge ourselves and add new tools, and really monitor the progress of the project and keep score.
So we're just about at the tail end of the discussion, and we've provided the roadmap, the simple framework. We provided the levels of integration. We've identified the components that might facilitate that integration. But you still might be asking yourself, where do I start? Where do I go next, right? And the reality is it starts here. It starts with each of you guys understanding how one component impacts the other, how a mistake could be leveraged to be a huge strength, right? But if you don't promote that culture, not from your individual perspective, but if you don't empower those that you work with, you work for, and those that work for you, then it stops. The idea is great, but what's an amazing idea if it stays in the head of a genius, right? Can you imagine if Steve Jobs and crew never launched the iPhone? What would you guys have been taking your selfies with? A droid? Right? Like, it's important to share this. I hate green bubbles. It's important to share these again, the strengths and weaknesses of every process. It's important to embrace the discussion. And so I think that's what I would like to do now. I would like to invite all of us to have an open discussion about thoughts, positive or negative, or concerns. Let's talk about what you guys might see as constraints to applying this thought process or culture on your projects. So if you guys could entertain me, I think you guys have pretty decent groups at each of the tables, except this gentleman. Like if you're able to, just turn around. And let's take 5-10 minutes. Let's discuss internally at our tables either subjects that popped up today or things that you were thinking about from previous experiences that we'd like to do a little bit deeper of a dive in. We will do our best. We're not the teachers per se, but to engage in the conversation and hopefully facilitate some substantial responses from any corner in the room. Again, we're trying to leverage the perspectives that we have right here, and it's an perfect opportunity to do so. So let's take that 5 or 10 now and let's regroup and see what problems we can solve together.